Hi, welcome back. My name is Lainey Bruner-Knute. I'm the Assistant Commissioner for Quality Management at DDS. It is my distinct honor and privilege to introduce Dr. Susan Roberts. Dr. Roberts is a behavioral psychologist and received her PhD from the University of Kansas in Human Development and Child Psychology. She has consulted for the Brain Injury Services Department of the Massachusetts Rehabilitation Commission and numerous agencies supporting individuals with brain injury for over 30 years. Dr. Roberts began her clinical work in the field of brain injury at the statewide Head Injury Program Neurobehavioral Unit, established to meet the needs of individuals with severe behavioral disorders associated with acquired brain injury. Dr. Roberts also has been a psychologist with the Department of Developmental Services and served as a member of the Commissioner's Advisory Committee on Positive Behavior Supports and the DDS statewide clinical consultation team. Dr. Roberts was clinical director of the South Shore Mental Health DDS inpatient unit at Arbor Fuller Hospital and served as an adjunct faculty member in the Department of Psychiatry at Harvard Medical School. She has authored numerous articles for peer-reviewed journals, as well as 2 books published by New Harbinger Press, Living Without Procrastination, which I sometimes need, and Living with ADD. Dr. Roberts is currently Clinical Director for Community Living and Day Services for Brockton Area Multi-Services, Inc., BAMSI, as well as a consultant and a member of the ABI Continuing Education faculty for the Brain Injury Association of Massachusetts.
Thank you for joining me this afternoon. I'm happy to be here and talk with you about planning to present the principles. So our job here today is to prepare the presentation of the principles of engaging in waiver services. And our topic is important. Implementing the principles represents a commitment to a major change in our culture by expanding diversity and inclusion. And I'm excited for the opportunity to work with you today on this topic. But of course, it's no small task, and I understand that the development of the principles has been underway for over 2 years, which lets us know that this is not a small or easy task that we're taking on. But by the end of our talk, you'll have the tools you need to prepare an effective presentation, one that will engage individuals and then lead to the kind of culture change that we want to make. So our job of ours is preparing to present the principles, and that puts us at the intersection of brain and behavior. And to make a good plan, we need to bring the information on the nature of an individual's injury or illness and its impact on an individual's life, together with the expectation of the principles, and to do that in a meaningful way. I like to use the framework of positive behavior supports, PBS, when it's important to build a system that involves many moving parts. And I want to introduce some aspects of this approach that will touch on our preparation. So PBS is a framework for delivering services, and it is organized around values. The most important one is to enhance the quality of life for all individuals. And then everything we do after that follows from this value. So PBS is a good fit for incorporating the values of culture, diversity, and inclusion into our work. Just by way of background, PBS began in Massachusetts in the 1980s in response to the use of aversive consequences, in response to an agency that used electric shock and other aversive consequences for dangerous behavior. But PBS did not gain traction at that time. However, the U.S. Department of Education did become interested in PBS and had a National Institute on Disability and Rehabilitation Research grant, developed the framework for PBS. And PBS is now in over 30,000 schools across the country. And it has now become part of almost every DDS office across the country as well. Massachusetts adopted PBS beginning in around 2012. And then in 2021, Massachusetts TDS reorganized the regulations around the principles of PBS. Those regulations were promulgated in, February of 2020, and of course, in March, we began the lockdown, so we have not been able to roll it out and implement it thoroughly yet, but we are in the process. So PBS is a good fit for brain injury as well. And the 2003 Journal of Head Trauma and Rehabilitation was a good report on PBS and its effectiveness with the brain injury population. And PBS does focus on antecedent management. And that's much of what we're going to be talking about today. So how are we going to set this up to be successful? And how are we going to set this up to avoid problems? So in PBS, a starting point is to emphasize that behavior, all behavior, not just the spoken word, is communication. And keeping this in mind will help us today in our preparation keep a clear purpose. Hearing an individual make racially charged comments can be uncomfortable, to say the least. But if we ask, what is this behavior trying to tell us? Then we can avoid the distraction of judging and labeling others and focus on our job, which is to understand where is this behavior coming from? And then we'll be in a much better position to influence it. So just a quick overview of the PBS framework, as it will help us today think through the types of support individuals will need when presenting the principles. So PBS is a tiered system for providing support, and this triangle represents the 3 levels of support that can be offered. The universal at the bottom level, the green, and the targeted level in the middle in yellow, and then the intensive level of support, which is at the top, and it's in red. The basic level, the universal support level, 80% of individuals will do well with just universal supports. And some individuals on the waivers live independently or with minimal support, and they're functioning at this universal level. So in terms of presenting the principles, you'll find that most individuals, around 80%, will respond without a strong emotional reaction. So your preparation for these folks will be less about how not to trigger negative reactions, but more to ensure that the content is cognitively accessible. Then around 15% of our population will require support beyond the universal level, the targeted supports. And that's when an individual needs help emotionally, medically, and behaviorally to cope with an issue. In terms of preparation for presenting the principles, you'll want to identify individuals who can be disruptive during discussions, may have difficulty remaining on topic, interrupting, etc., and then plan for these behaviors in your presentation. Finally, about 5% of our population will require intensive supports. And intensive supports are in place for behavior that is high risk to their safety and to others. And in terms of presenting the principles, you'll want to be sure to identify individuals who have a history of intense reactions to emotionally based information or events. So At the universal support level, it is foundational. All the other supports that we offer are based on the universal supports. And these supports are called universal because they are applied universally to everyone all of the time. And these are the kinds of the supports that all of us need to function well. And when universal supports are implemented well, with integrity, far fewer mental health and behavioral crises occur. You can prepare. So attention and arousal. Attending is essential to understanding and retaining information, and we're going to talk more about the effects of fatigue and stimulation later. Learning and memory. So think about, how is the individual's memory affected? Will memory issues be a concern for learning, for understanding and learning the principles? Are there constructional and visuospatial skills that will be important to consider? For example, if an individual has hemispheric neglect and is asked to read the principles, then the information will not be accessed successfully. Language and communication. For example, if an individual has aphasia, how will that impact the individual's participation? How will you respond to support the individual? Other neuropsychological domains to consider: perception, visual, auditory, haptic, which means touch, sense of touch. Is the individual wearing his or her glasses, hearing aid, when you present the principles? If not, how will you get the information across? Praxis, will the individual have any difficulty physically managing the materials or the setting? Academic skills, how does the individual read and write? If so, how well? If asked to respond to material that is incomprehensible, then the individual will not benefit from the presentation and may have emotional and behavioral concerns. In the area of executive functioning, we know the principles will challenge an individual's executive skills. You'll be asking an individual to follow this abstract process from a value statement of promoting diversity and inclusion regarding other people's race, ethnicity, and preferences, and then to bring it back and regulate their behavior accordingly. That challenges a lot of the areas of our executive functioning. And then finally, mental status is important for planning and presenting the principles, because if an individual is not in a state where information can be processed, such as the individual is in a psychotic state, the individual's under the influence of substances, then the presentation cannot be effective. So if the principles are presented in a way that's overwhelming or incomprehensible, then successful follow-through is not likely to happen. And in this case, most individuals will walk away with no real reaction, but there'll also be no real outcome. But some of the individuals, at the 15 and 5% level of the triangle, that will have difficulty participating in the discussion. Maybe in the form of irritability or even a stronger reaction resulting in agitation or aggression. In any case, if the individual does not understand the principles, then the purpose of the presentation has not been realized. And it may be also important to think about what the principles do not mean. I imagine some individuals will hear you say that they will not be denied services for their actions, but I know many of the individuals I work with will harbor that fear. So in thinking about each individual's cognitive concerns, you may want additional input into developing your plan. So for complicated cases, you may want to seek consultation before meeting with the individual and get input on how to make the principles most accessible. So assessment. very important first step for all of us. It's important to consider the experiences an individual has had with issues of race, sexuality, ethnicity, etc. And it's to be expected that such experiences will influence the individual's response. In some cases, discussion of diversity will trigger an individual who had an adverse experience with people from different cultures, races, etc. And trauma may be part of the individual's history. And an emotional response in that case may occur very quickly before the prefrontal cortex can signal that there really is not a threat occurring. And also, what is the individual's social learning history? Did family, friends, community normalize animosity towards people who are different? And how does the individual see other people's racial and ethnic comments? Some individuals, usually at the top 5% of the triangle, have significant problems with impulsivity, and the mention of not using racially charged language may set them off before any real discussion occurs. Now, in addition to considering the individual's history with people of different cultures, religions, and preferences, it'll be helpful to consider how the individual responds to difficult discussions. What have you observed? What have you heard? What have you learned about the individual's behavior at meetings such as the ISP, in therapy, at difficult house meetings, family get-togethers? It's important to understand how the individual has responded to emotionally charged conversations in the past. And it's also important to know and to draw on an individual's strengths to build buy-in. An individual I worked with took a lot of pride in being the kind of man who was valued in the pre-baby boomer generation, honest, hardworking. And when I went to his house to facilitate a discussion regarding the collective anger housemates had to one individual who was having a frequent emotional outbursts, we asked this gentleman to draw on his long experience in the field of law enforcement to encourage peers to stay calm in the presence of disruption and as the safe thing to do. He had influence with his peers, and it also enhanced his feeling of being important and making a contribution. So there are two primary opportunities that have been identified for presenting the principles. For individuals who are moving into the community from a facility, the principles may be presented at the transition meeting. In that case, it will likely be difficult to get the information you need to plan the presentation. So you may have to be resourceful in these cases. For individuals already living in the community, presentation at the ISP may be appropriate and effective. Even still, it's worth thinking through issues noted in the preparation worksheet so that you can plan for the cognitive supports needed. But for some individuals who are easily triggered or have an adverse history with people who are different, it may be advisable to plan to have this presentation at another time and in another setting. Okay. So in planning, we want to think about planning for the individual. We'll also talk about planning for other people who may be involved in the discussion. So for the individual, think about when should the individual be invited? Some individuals have anticipatory anxiety and need a shorter window for an invitation. The gentleman I just mentioned was very anxious around medical appointments. So appointments were scheduled for the afternoon, and he was informed of the appointment in the morning after he got up and had his coffee and breakfast. And that worked for a while. And then he decided he didn't like such short notice and asked to be informed when the appointment was made, which is what is done now. So when do you invite the individual, and how will you invite the individual? Do you want to send a written invitation? That could be helpful with memory, especially for someone who lives independently and may not have someone available to help schedule and to remember. And who, if anyone, should you invite to join the meeting? The individual may want or need someone there for support, and the support person could be very helpful to the individual in terms of remembering what was said as well as what was not said. You may also want to have someone with you. It could be important for your safety when meeting with an individual who is not top 5% of the PBS triangle. So what would you do if an individual were to want someone to join the presentation who was not a stabilizing personality? Think through what you might suggest, recommend, ask for in that situation, but it's important to be prepared. How do you want to present the reasons for the meeting? An anxious person may fear that he or she is going to be confronted. What will you do if the individual flatly refuses to attend, knowing that he or she does not need to participate in this discussion, does not need to hear about all of this? So we want to think about how we present the rationale, the reason for the meeting, and how we can engage the individual in joining us. We want to plan too for provider, family, and others. Would you want to invite significant others, providers? What would be the likelihood that an individual significant other will be helpful or dysregulated or disruptive? And again, what would you want to do? How would you plan for that? And how would you explain the rationale, the need for the meeting to a significant other, a family member, or a provider? And how or would you ask for their support in presenting the principles? So we mentioned earlier that arousal and attention are concerns, and I think it's worth stopping and noting this effect, because as many as 70% of the individuals with traumatic brain injury report that fatigue is a serious concern in their daily lives. And we know that there are different types of fatigue. There's physical, which is just, I'm tired and I need to rest. Psychological fatigue, when just can't get motivated. And then there's mental fatigue, when after a while it's difficult to concentrate, it's hard to stay focused, the mind goes blank. Sleep disturbances, either sleeping too much or too little, or having poor quality sleep, is common following brain injury and other illnesses. Additionally, individuals who are prescribed psychotropic medications or anti-seizure medications, that can also affect or result in their tiredness. So how might fatigue factor into the presentation? Do you need to select the time of day with this in mind? Do you think you can cover all of the material at one time? Should you plan breaks in the presentation? See, there's some of the factors that will have a big influence in terms of the individual being able to sustain attention and participate meaningfully in the discussion. So we have the who. Now what about the where? Where you have this meeting will have an effect, an impact on your success. For individuals in group living situations, it may be a bit easier, as homes typically have areas where private meetings can occur. but you want the setting to say, this is professional and this is important. So select your setting with those thoughts in mind. If you're meeting an individual in a private residence, it can be difficult to arrange a setting that meets these professional needs. Privacy, too, is an important consideration in where you meet. It's too often discussions occur at the kitchen table with housemates or caregivers wandering in. And in a private home, this can be a problem too, as space may be limited. And finally, you want yourself and the participants to be reasonably comfortable. And because it may take a while to talk through the principles, answer questions, explain rationale. So you want to be sitting at a conversational distance, 6 feet in this day and age, and at eye level, unless there are safety reasons not to. So in your setting, you want to think about the stimulation level. Okay, what are the possible interferences? And we discussed the fatigue and the need to schedule around known downtimes, but what are some of the other possible disruptions to your presentation? In group living, the change of shift is, of course, a difficult time to meet, with much commotion and people coming and going. In a private home, there may be interference too. If a family member comes home during the meeting or a caregiver arrives to begin a shift. Some individuals use a phone or an iPad for cognitive support, but you want to be sure these devices are not interfering as well. And finally, if other supports are joining the meeting, it's important for them also to be attentive and not scrolling through phone messages. So overstimulation. In a setting that is quite stimulating, how will the individual process information? If an individual processes slowly, struggles to sequence, or forgets easily, and perhaps has fatigue from medications or poor sleep, then stimulation, even minor stimulation, can be a concern. So if any of these concerns occur, a distracting environment can make it nearly impossible to focus. So overstimulation may result in the individual feeling overwhelmed, and behavior may become dysregulated, or the individual just does not benefit from the presentation. I remember working with an individual, this was years ago, who was participating in neuropsychological testing, and she was fascinated with the tester's ring. He was from a different culture, and it was an interesting ring. And it was very distracting to her, and so she could not give her best responses, and consequently did not test at her actual ability. So it's important to consider how distractible the individual is and how distracting the environment is as well. And it is almost important to eliminate all distractions, but reducing the general stimulation level is important. And again, that can be even more difficult if you're meeting with an individual in their private residence. Okay? Clutter. Again, we're talking about where we're meeting, and there's been a lot of information coming out lately about the effects of clutter on our behavior. I thought it was relevant to bring this in now as well. Princeton University Neuroscience Institute in January 2011, the Journal of Neuroscience published a report that in using fMRIs to map the brain's response to organized and disorganized stimuli, and monitored the individual's task performance. And the conclusions were strong. If you want to focus to the best of your ability and process information as effectively as possible, you need to clear the clutter from the environment. This research shows that people are less irritable, more productive, distracted less often, and able to process information better in an uncluttered and organized space. Oh, Zoom meetings. Will you be meeting by Zoom? After 2 years of Zoom meetings, we all know there are pros and cons of this medium. It has enabled more opportunities to meet and to allow for more spontaneous meetings to occur, but there are problems, of course. Technical difficulties occur frequently. You want to be prepared. Does the individual have experience meeting by Zoom? Will this be comfortable? Will the individual be comfortable in this format? For effective conversations, we know it's important to be at eye level with recipients, and maintaining eye-level conversation can be difficult on Zoom. And it's also important in having a real conversation to maintain a certain physical distance, and that too can be difficult on Zoom. Sometimes we're sitting at such a distance from the camera that the whole setting, the whole feeling, the experience becomes very impersonal. And if there's a way around that, it's certainly worth pursuing. And if you are using Zoom, it's important for you to be able to see everyone in the room on camera so you can assess the reactions that may be occurring, because they may be contagious. So those are some things to think about if you are in fact going to be meeting by Zoom. Okay. So we're ready to get started on preparing the presentation. You've determined who will be there, how they will be invited, and why. You've selected a good setting. But before you start the presentation, it's important that you check with the provider if possible. How has the individual been that day? Have there been any recent incidents of concern? Find out if there are any time constraints that you didn't know about, and decide if this is still a good time to go ahead with the presentation. For individuals living independently, there may not be anyone you can check in with right before the meeting. So, you'll want to spend a few minutes making small talk just to assess, the individual's affect and where they are at that moment. And you want to assess the mood of the individuals, of the other participants as well. What is the affect in the room? And how would you proceed if someone appears to be out of sorts in some way? So if you detect that the situation is not favorable, such as the individual appears to be agitated, under the influence, stressed out about an event, you might think about postponing the presentation to a time when you will be able to have their full attention and can make it meaningful. I want to thank Dr. Teresa O'Neill Perosi for allowing use of this slide. And throughout the years and working in the field, I have heard countless times, it's all in the approach. And there's a lot of truth to that, because it's as if we have a few short seconds when meeting an individual to gain their attention, or it can be an uphill battle, to say the least. So how you come across to the individual, it can make or break the work you need to do together. And as we discussed, again, no one is likely to be excited about having this discussion. And for that reason, it's important for you to use all the communication techniques you have at your disposal to make this meeting effective. So following Dr. O'Neill Perosi's information, communication can be divided into a couple different categories. And the first one we'll talk about is the verbal communication. And you want to do all you can do to signal that this conversation is important and it has your full attention. So by using the person's name, you'll communicate a respect for the individual, and it'll get the individual's attention. We all look up, we all pay attention when somebody is using our name. That can be helpful getting this discussion started. You want to use small amounts of information, make a point, stop for a few seconds. You want to keep it simple, okay? So pace the presentation in a way that's comprehensible and comfortable for the individual. We know that individuals we support are often focused on themselves, and that's understandable. Now, living with a brain injury or a severe illness requires a lot of effort, sometimes even for small everyday tasks. It can be very helpful for you to explain how these principles will benefit the individual. When we're asking individuals to do something that they might not have chosen to do, and under difficult circumstances, I think it's reasonable for them to want to know, to expect to hear how this will benefit them if they are to participate in this culture change and really pay attention to communicating with respect. And there's a lot of information, so again, go slow and pace it according to the individual's needs. Okay, so another important component of communicating effectively is how we physically present. And we all know that, 80% of communication? It's not about the words we use, but it's about our tone, our affect, our physical presence. So give the individual your full attention. You want to be sensitive to how this information is coming across to the individual. It's also very important to be aware of your feelings at the time and about the subject and how they're coming across as well. You want to be face to face so you can see mouth movements. And some people that we support have a hard time separating sounds in the environment. So being able to see your face and watch your mouth will be important for them too, in terms of understanding and following the conversation. And attend to facial expressions and voice inflections, not only of your own, but of your participants as well. So I know I'm probably preaching to the choir, and you're professionals. You've trained and you have experience, and you know about effective communication. But it's really important to keep these basics in mind as we engage individuals in difficult discussions. So, in addition to following the tips for effective communication, it's also important to listen actively, and that's the stop, look, and listen rule that we use. Stop what you're doing. Pay attention to the individual, look at the person, and listen, not just to the words, but really try to hear what are the feelings, what are the thoughts, what are the feelings underneath the words, because that's where the discussion is going to matter. And to respond, of course, in a supportive, validating. So in conversations, all conversations, there'll be moments where it may stall. And, a little silence in your presentation can be okay. But it is important that a conversation occur if these principles are to be meaningful and memorable for an individual. You want to admit when you don't understand what an individual is telling you. You don't want to assume that you know what they're saying. So you might want to use some of these conversation bridges. They will help your understanding. And by asking questions, that will help keep the individual engaged in thinking about the topic as well. Keep it moving. Again, conversations lag. It's normal. It's okay. But rather than letting the conversation slide, keep it going. Again, it's asking questions and then listening, really creating a dialogue back and forth with the individual. It's good to ask open-ended questions. Nothing kills a conversation like yes and no answers. So ask questions, follow up with why not, how, and really help the individual to express their feelings, thoughts, and sort of dig in a little deeper for themselves in terms of how they feel about this topic. So now you're equipped to make a well thought out presentation. You've thought about how this process looks and feels to the individual. You've thought about the nature of an individual's injury or illness and how that will affect their ability to participate in the conversation. You've identified cognitive supports that are needed to facilitate the conversation. You've explained the need for the meeting in terms of the benefits to the individual. You've selected a good time and location. You've communicated effectively. You've listened well. And you've kept the conversation going. And still something goes wrong. That happens too. In this case, we're probably talking about the top 5% of the triangle, where the presentation becomes so disruptive that some corrective action will be needed, usually in the form of an individual becoming disruptive, loud, argumentative, even threatening. Some individuals may break down and sob as they are reliving some experience that they've had where they felt terribly disrespected by someone else. And that needs to be understood and supported as well. So expect the unexpected and prepare. So just a little bit about what to do when things kind of go off track. We've talked about maintaining a low stimulation environment, reducing clutter where we can, noise, careful consideration of when, and who and where to meet. So you've setting the right stage. But when escalation starts, an added attention to keeping things calm is needed. So when a behavior of concern occurs, it is important to recognize it and to take it seriously. It's important not to ignore the early signs and stages of distress, especially in someone has a history of agitation or dysregulation under stress. So as this graph shows, an early response can be very helpful in keeping everyone safe. So if you look at the graph, in terms of behavior increasing over time, you get to a point in terms of the intensity axis where the ability to be rational is lost. And as the behavior escalates beyond that point, you're now in crisis mode. And the goal at that point is to reduce the damage and keep everybody safe. But if you can intervene early and successfully, as you see in that bottom curve, you can bring the escalation back down and probably resume the presentation. But it's all in a matter of recognizing that things are going off track and taking it seriously and responding in an effective way. So you're going to continue to assess affect throughout the presentation. And if you sense a shift in mood, think about how you will be prepared to respond. Again, going slowly and slowing things down even more, intervening early, those are the key, okay? Now, if there are others in the room, say you have invited someone for support, the individual has asked to have someone present, they're going to want to help, okay? Typically, when the escalation starts, the other person's going to want to explain the question that you just asked, or explain the comment that you just made. They want to offer suggestions. But generally, this is not a good idea, as it contributes to the stimulation to the point of overstimulation, and then it can lead to dysregulation. So if an individual is showing signs of becoming distressed, it's very important for one person to take the lead and do the talking at that point in time. If that is entirely ineffective, then that person should leave and somebody else takes over, but really only one person is doing the talking. So number one, stay calm, slow things down, and then the next step will be to redirect. And again, this is assuming you're still at the level of rationality. You have not gone into the crisis mode. So it's key to the key to redirection is to tell the individual what to do. Generally, people redirect by telling the individual what not to do, stop, don't, etc. But that's problematic in that the individual still doesn't know what to do. So they have to stop, manipulate their thinking to come up with the right answer. And that's a lot of effort, and some folks just can't do that, especially when they're under stress. You can also ask the individual, you seem upset. Are you okay? What do you need right now? What would help? And that can be a good, an effective approach, especially if you don't know what would help the individual. But if the individual then says to your question, what would help, they say nothing or I don't know, that too is important information. And you'll know that the individual's still in an emotional mode and not rational and not able to come up with solutions. So at that point, you may want to suggest an activity. Take a break, go get a glass of water, something that will change the setting and allow the individual an opportunity to regroup. So redirection is a bit of an art, and practice, like everything, is the key to honing your skills. But there are some general useful tips to use. And the first is, when redirecting behavior, it's generally very helpful to start with a validation. And you want to validate not the person's behavior, you want to validate the feeling behind the behavior. So maybe you say something like, I can understand if you're upset, if you feel that staff are disrespectful to you. I understand that. You're validating, you're telling the individual, you're right, it's okay. You're not alone, I hear you. And it's also very difficult for someone to be upset with you when they're agreeing with you. So you're joining the individual and communicating compassion and understanding. And that can be very helpful in terms of turning the corner on distress. You want to try to say yes to whatever they're saying. Yes, I do think sometimes staff can be rushed in their approach. And yes, I understand how that's, that's frustrating. Yes, you're validating. Again, not any inappropriate behavior, but you're just validating what they're saying is real to them. You want to use momentum where you can, and basically that's a technique where you get the good feelings flowing, okay? So, for example, you arrive for the meeting of the principals, and the individual says they don't want to meet with you after all. What do? You could say you understand that, how the person might not want to meet, and maybe engage the individual in some sort of small talk, on a preferred topic. Hey, did you see those Super Bowl commercials? I don't know, just, some topic that the individual enjoys chatting about. So you chat for a while. And then you say, hey, you know what? Since I'm here, let's just meet for a bit, and then I'll get out of your hair. That may work, okay? That may be an effective redirection for someone who is resisting the meeting. So basically, you're looking for a way to sort of establish rapport and then reintroduce the topic. And again, I know I've mentioned this before, but in general, it's helpful if you explain the benefits to the individual of having this discussion in an immediate and personal way. For example, maybe you would say something like, I hear that you don't feel the need, that you have the need for this meeting, but I know that these principles are going to be talked about a lot. So you'll be the man in the know after we finish talking about it. You'll be prepared for when you hear other people talking about the principles, and you'll be able to, to join in a way. Something along those lines. I'm not giving you a script to use by any means, just an example of how you might present the importance of the topic in a way that's, understandable and acceptable and relevant for the individual at that time. Okay, so those are the do's, and here are the don'ts of redirection. It can be a mistake to think when some sort of level of distress arises that it was because the individual did not understand what you just said or asked. So be careful in terms of explaining or trying to correct a misunderstanding at this time. It could make the situation work. If you do attempt an explanation and it doesn't take, drop it and realize misunderstanding is not the issue. It's probably some emotion that's arising rather than confusion. Okay. Just as we talked about using the word yes, you want to banish the word no. Okay. Because after that word is said, often, typically, nothing else is heard. All they've heard is no. And the word no is a trigger. It can be a trigger for many individuals. So try to say no without using the word no. And there are many, many, many ways to do that. For example, you can say, yes, 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 we can. But first, could we do this? So there's a whole conversation we can have in terms of how to say no without using the word. Okay. Sometimes during a moment of discord, some folks will want to make an attempt at humor, and the thinking that laughter and humor is incompatible with agitation and distress, there's some validity to that. And it can work, but only if you know the individual really, really well. So when an individual's upset, tired, overstimulated, an individual's more likely to take your attempts at humor personally. So be cautious. You probably want to avoid the use of humor in that situation. And then finally, for redirection, when it works well, stop, okay? We'll leave it there. I've seen many a good redirection ruined when somebody says, well, I'm really glad, it's good to see that you calmed down. Thanks for working with me and calming down. And in the future, you really need to think before you act. That just blows the whole redirection right there. So stop with when you've met your goal, the situation is diffused. Just focus on calm. Teaching better strategies comes later. And then the last topic in this particular area is just to consider when power struggles emerge. And you want to, of course, avoid power struggles, but slipping into them is easy. Then the first step to avoid them is to identify that it's happening. And this takes practice. You'll step right into many power struggles before you realize it, and over time learn to recognize the feelings and the signs and the symptoms that they're occurring, and then be effective in getting out of them. So here are some steps to keep in mind. When a power struggle begins, you want to stay calm. Hide your frustrations. Take a deep breath and say to yourself, no one wins a power struggle. Take another deep breath. Okay. Stay focused. Ignore everything you can ignore. If the behavior isn't interfering, isn't unsafe, try to ignore it. If an individual complains that he's told you repeatedly about an issue and that you've just not responded, individual says he told you not to come at this time and that this was not a good time for the meeting of the presenting the principals, you don't want to try to argue with them. You don't want to disagree and try to explain the truth. You can correct any misunderstandings later. What you want to do is stay focused on keeping, helping the individual stay in control, and making some decisions about where you want to go next. And to that point, you may want to accept a compromise. For example, we were just talking, the individual doesn't want to meet with you when you arrive for the meeting at the time that was agreed upon, and that can be definitely frustrating. Then you want to ask, well, okay, how much time do you have, or do you have any time? And perhaps the individual says, well, I can talk 5 minutes. And you say, that's fine. And you validate and accept the individual's solution to the problem. And who knows, things may go on beyond the 5 minutes or not, but it's important to bring the individual into the disagreement in a rational, contributory way so that a mutually agreed solution can be found. And you want to listen. If an individual starts to argue, listen to them. Listen without interrupting. Validate them by saying, okay, I see your point. Okay, so that's what you're saying. Spend that time. Don't interrupt. Even there's maybe complaining that, these principles are ridiculous. They don't need to listen to them, that this is just ridiculous. You give them time to vent, unless it's going into an escalating situation. But if they're expressing, an opinion that's, different, that's fine. Just listen, okay? And lastly, you're going to want to know when enough is enough and how to get out of that struggle, okay? So one general option is to say, I think we're both pretty much into, think some of our, feelings about this subject. What do you say we take a break? Think it through. We can talk about it later. So you probably are going to want to suggest take a break or to reschedule. But it's important that you try to bring this disagreement to a close, to a successful, calm ending before things get out of hand. Again, these are some of the techniques I think you'll find are useful to think about how you might implement, especially with the that top 5% of the triangle where impulsivity and intense negative emotional reactions may occur. All right, so you've implemented your plan for presentation. You kept things calm all the way through. So how do you want to end the meeting? What will you leave with the individual? Will you leave some of the cognitive support supports that you may have employed for the presentation? What should the individual do if they have questions or misconceptions about what occurred during the presentation? It's important to let the individual know who to go to and how to reach that person to clarify misunderstandings. And when the presentation is over, check in with the caregivers who are there. And this is true even if the caregivers were part of the meeting. The caregiver too may have questions or misunderstandings that you need to clarify. So it's important to let the caregiver know, how to respond to questions or who to call if the individual later has some concerns or has a reaction. And then after closing the presentation, you're going to want to communicate with the important people for this individual with permission, of course, and let them know what was discussed, why it was discussed, and how to respond to questions they might hear. There may be a need to schedule a follow-up meeting with the individual, the family, significant others. It depends on the contribution of the family member or significant other to supporting the individual. So the principles present us with an important opportunity to change the culture by promoting inclusion. So include, all of the people that are important in this individual's life. Bring them into the conversation and keep the conversation going. And after you've had a successful presentation, the task then becomes, how do we keep the momentum going? How do we make the change to the way we support individuals so that these changes can last? The principles provide an opportunity to influence the culture by promoting diversity and inclusion, but then the task becomes, how do we maintain the momentum? How do we make it last? So, with a good plan, you will be successful in introducing the principles, but setting the expectations is just the first step. We'll need to find opportunities to keep attention on the principles. I hope you'll be thinking and discussing ways to keep them forefront in the environment until they become habits, and then they become traits, and then they become part of the culture. Thank you.